The topic will be about surgical site infection. Can we reduce it or not? I'm Ibrahim Galal. I'm a professor of surgery, Cairo University. I'm specialized in bariatric surgery. I saw your marvelous session this morning. Permit me to introduce my grandfather. Surgical site infection is the third common type of surgery-related infection after catheter-related sepsis and chest infection. Of course, we all like to have a very healthy and clean environment like this, but this is not the truth. Surgical site infection is a worldwide problem. It ranges from 3 to 5% up to 26% of cases according to the specialty. In colorectal surgery, of course, it entails the highest rate. Infection is a state of tissue injury induced by bacterial invasion, multiplication, and toxin production. All surgical wounds are practically contaminated, but not infected. Conversion from contamination to infection is the problem of virulent organism, weak immunity on behalf of the host, or suitable environment. The morbidity of surgical site infection ranges from simple delayed wound healing to severe systemic sepsis with multiple organ failure and even mortality. On the other hand, repeated wound dressing, antibiotics, culture and sensitivity, admission to IC unit, admission to theater for debridement, secondary suture, pus drainage, etc., exhaust the health care resources and also the general economy. Let me introduce some of the examples of minor sepsis producing major problems. This is a diabetic patient who just removed a small corn by a razor, and this produces gangrene. Another poor lady with reduction mammoplasty with a prosthetic implant, she developed infection, disruption of the wound, ugly scar, exposure of the prosthesis, and explantation. Another poor case with open heart surgery with sternal infection, necessitating resection of the whole sternum, costal cartilage, flail chest, and major surgery of chest wall reconstruction. All of these problems are produced by infection. Surgical site infection is defined as any infection within the first post-operative month. However, in the presence of foreign body, you can extend this period to the whole first year. Why? Because infection to occur needs 1 million bacterium per gram tissue. When a foreign body is there, this count drops to 100. The most frequent foreign body in any wound is the surgical suture. It is a foreign body, especially if it is a non-absorbable. This is the role of the surgical sutures. These are the filaments of the thread. And these white balls or spheres are the bacteria. The filaments produce a scaffold-like maneuver that helps spread of infection. This is one of the consequences. You may have some erythema or microabscess in relation to a stitch, the so-called stitch sinus or skin gap. However, sometimes surgical site infection produces this disastrous result: burst abdomen, extrusion of the gut. Can we prevent infection related to sutures? We have to try. Let's revise the CDC guidelines for prevention of surgical site infection. The CDC is one of the major institutes working in preventive medicine. It is community disease prevention center present in Emory University, Atlanta, Georgia, USA. There are several important factors to prevent infection. Topping the list with highest grade of evidence is the use of antibacterials, whether systemic as antibiotics or local as antiseptics. However, the use of systemic antibiotics may be accompanied by hazards like adverse reaction of antibiotics like anaphylaxis and presence of bacterial resistance, superinfection, fungal infection, vitamin deficiency, and usually antibiotics are costly. If you can use local antibacterial antiseptics, we may provide an escape from the hazards of systemic antibiotics. The rules are use an antibacterial which is safe and effective. Effective against what? The common pathogens. The common pathogens in surgical site are usually this long list. However, the most important is Staph aureus and the most famous MRSA. Local antiseptics of value are four: either alcohol, propranolol, chlorhexidine, povidone iodine, or lastly, triclosan. Our champ. Triclosan is a derivative of phenol. Phenol is long known as an antibacterial agent. Phenol or triclosan in particular is used in the market since 1965. This means it is 52 years in the market. I think it is older than most of the audience. Pharmacokinetics of triclosan, it is rapidly absorbed even from intact skin. It is metabolized in the liver, excreted through mainly the kidney. Triclosan is present in every single product. You are sitting on a chair in which triclosan is embedded. You are walking on this floor, it's containing triclosan. The fabrics are, triclosan is added to it. When you brush your teeth, you use triclosan containing toothpaste. When you brush your teeth, the toothbrush may be impregnated with triclosan. I'll tell you some of the famous products like Dial soap containing triclosan, like Colgate, like Reach toothbrush, like Janina toothpaste, Old Spice shave gel, it's Gillette shower gel and shave gel. All these products, toys of children, cosmetics, detergents, you cannot escape exposure to triclosan. You cannot. There are different types of triclosan in the market, at least 20. All are FDA approved. The most pure form is the Ergazan, and this is our champ. This is the one that is picked and added to Sutures. Let's revise the guidelines put by the World Health Organization, or the WHO, in 2008. I'll read the slide as it is, because these are recommendations of the WHO. Triclosan has an immediate and sustained effect of antibacterial function. Number two, it can be active even in the presence of organic matter. And most importantly, is non-toxic, non-allergenic, non-teratogenic, and non-mutagenic or carcinogenic. The most recent update of WHO recommendation is that the panel of WHO suggested the use they are suggesting the use of triclosan-coated sutures for the purpose of reducing risk of surgical site infection, irrespective of the type of surgery. Let's have an example. An average person is exposed to the consumer products I've just mentioned daily. What is the amount? Around 100 microgram per day. Okay, and this is safe. You can tolerate this. We all tolerate this. When you have surgery like hernia, you use around 5 to 7 packs of thread. The thread length is around 70 centimeters. So you are consuming around 5 meters of thread. How much containing triclosan? Around 3 microgram. 3 microgram. So when you do hernia, you are exposed to 1/30 times the exposure to the usual daily consumer products. Triclosan has antimicrobial activity in low concentration. It is bacteriostatic, and in high concentration, it is bactericidal. It acts by disruption of the cell wall. It is broad spectrum. It acts against most of the bacteria, most of the viruses, most of the fungi, but it does not have any activity on Pseudomonas aeruginosa. The evidence said that there is no resistance with the repeated use of triclosan. There is no bacterial resistance. Another important point, adding triclosan to sutures does not change the integrity of the suture. The tensile strength, the reaction, and the absorption, all characters of the thread are not changes. However, we have some concerns. These are health activists. They raised health concerns. There are 3. Number 1, dioxin formation. Number 2, chloroform production. And lastly, endocrine disruption. Dioxin, there are four products of dioxin as metabolites of triclosan. And none of them is toxic. There are more than 200 types of dioxin. 17 of them are toxic. None of them is produced by triclosan. When you expose triclosan to tap water, it may change to chloroform. It may be injurious. But this is not the case in surgery. You don't put the threads in contact with tap water. Lastly, endocrine disruption. Triclosan competes with thyroxine for the receptor sites, preventing its effect. But this is only proved in this poor American bullfrog, not in human. So let's revise the last comments. FDA, if you want to specify the effect, did not find any cause to limit the use of triclosan. This was in August 2012 and revised in 2013. Another agency in USA known as the Environmental Protection Agency said that exposure to triclosan from all sources does not present any risk of concern. It is safe. Lastly, let me present some studies, some researches, some RCTs about triclosan. The first was in Spain in 2006. It was done on 10 animals and proved to the value of adding triclosan to suture in reducing infection. The second was in Austria. Cardiothoracic surgeon performed consequently more than 400 open heart surgery with no infection. And lastly, in Germany, in 2009, they performed a large series of patients, around 2,000 patients, comparing triclosan-coated polygalactin, Vicryl, versus using PDS in laparotomy closure with good results. Our study in Egypt was done in 2 large centers. One of them is Cairo University Hospital. Cairo University Hospital is 180 years old. the campus of the university contains 9 different hospitals in 9 different specialties. We have 6,000 beds in the hospital. We have 500 ICU beds. We have 2 million admissions per year, and we train around 6,000 trainees per year. This article was published in the American Journal of Surgery in August 2011. The study objective is to assess the value of adding triclosan to surgical sutures. The study included around 600 cases divided into 2 groups, each contained around 300 patients. One in which we use triclosan-coated sutures, and the second when we do not use triclosan with sutures. The randomization of this study was done by computer-generated program, and the medical team was blinded about what they are using. And the follow-up was done for 1 year in cases with foreign body implantation, and for 1 month if no foreign body was present. Statistical analysis was done by this Hook, one of the professors of statistics in our university. Results. We scanned around 780 patients, excluded some of them because they are not complying with the prerequisites. They are excluded or refusing to be followed by this scan. And we have 700 patients divided into the study group with triclosan and the control group without. We lost some patients in the follow-up period, and the dropouts mounting 12%, ending with around 300 in each group. They are covering all surgical fields, as you see: hernia, breast, vascular, gynecological, orthopedic. Every single specialty was tried. I want you to see this. In all wound categories, the incidence of infection in the study group with triclosan is much less than without triclosan. And the overall incidence of the study, we had infection in 7% of cases in the study group in comparison to 18% in the control group without triclosan. Statistical analysis proved that we have a very highly significant p-value. And another aspect is the period of hospital stay. It was nearly doubled, at least, in cases in which infection occurred. And this is translated into money. The cases per year were studied with infection, and it cost $1,500,000. In Egyptian pounds, it is around 27 million Egyptian pounds more in infected cases. In conclusion, using triclosan in surgical sutures may reduce surgical site infection by nearly 1/2. And these results are complying with that of other studies. It's not only preventive regarding infection, but also it saves a lot of healthcare resources and hence the general economy. What to take home? Prevention of infection is definitely a multidisciplinary approach. One of the armamentarium in your wallet or in your weapons against surgical site infection that you may use triclosan-coated sutures to prevent and reduce surgical site infection. Thank you.